ahead and get started. If you haven't silenced your phones, please do so. Well, good afternoon, everyone, and thank you so much for joining us. My name is Katie Baker, and I am the Virginia State Director for Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through educational events like this one. I want to thank Congresswoman McClellan, former Congressman Tom Perriello, all of our panelists today, and I know we have some elected officials in the audience, Ziana Bryant and Amanda Burns from the school board, Lloyd Snook from, Councilman Snook from the Charlottesville City Council. Any other elected officials I missed? All right, well, thank you so much for joining us today as we are making our Charlottesville stop of the Sick of It tour. Sick of It is a national months-long effort that Protect Our Care is doing in many states all over the country to sound the alarm on all the Republican healthcare cuts and their impacts on our communities. And our message is simple. We're sick of it. We are sick of Republicans, including Congressman John McGuire, who have cut our health care in order to fund tax cuts for billionaires. And we're not going down without a fight. So with that, I'm going to turn it over to Congresswoman Jennifer McClellan, who has been a tremendous champion of health care. When she was in the state Senate, she actually patroned the legislation that created the Affordable Care Act marketplace in Virginia. And she says yes to everything we ask her to do. So happy to be with her in Charlottesville today. Congresswoman.
Thank you. Excuse me. Thank you, Katie. Thank you. Yes, I was very excited to carry the legislation to create the Virginia marketplace. I was very excited as a member of the state Senate to expand Medicaid and to ensure that more people got health care coverage, so that they knew they'd have the peace of mind that they could get the care they need when they needed it without going bankrupt. Now, as a member of Congress, I sit on the Energy and Commerce Committee, and last April sat through a 26-and-a-half-hour hearing telling stories about how the largest cuts to Medicaid in American history would impact our communities, would impact patients, would impact providers, and especially in rural areas, telling stories similar to those you are going to hear today. A year ago, this very day, the last Wednesday of August last year, I traveled from Richmond to Abingdon, Lynchburg, Tazewell, and back here to Charlottesville, talking again to providers and patients about their worries about those cuts. There was a dental clinic in Abingdon that had just opened, and before they opened, people had to wait a year for the RAM clinic to come to get any dental work at all. Met with UVA Health and their concern about the impact the cuts would have on their ability to provide services. Went to Tazewell, where one of the hospitals was identified on a list as being at risk of closing if the Medicaid cuts took effect. That was after visiting another hospital in my district in Emporia that was also on that list. And when I came to Charlottesville and talked to the local press, and I talked to the press in Abingdon, one of my Republican colleagues accused Democrats of fear-mongering. And I said, no, I am just telling you what I am hearing from patients and providers and communities in my district and in his. Well, a year later, I have been traveling all around my district, and I'm back in Charlottesville to say, unfortunately, we were right. We were right. We have seen, because of the cuts, because the Republicans let the enhanced premium tax credits expire, 100,000 people in Virginia have already dropped their health insurance under the Affordable Care Act because they can't afford the premiums anymore. In addition to the 13 rural hospitals at risk of closing, at least 5 providers have already closed their doors. 3, Augusta Health out here in the west, at least 2 that are part of the capital area health center in my district. And just this morning, we saw in, I think it was Charlottesville now, the impact that the closing of the labor and delivery department in Farmville, and there's also a hospital in Lynchburg that has closed theirs, the impact that that is having on expecting mothers. And I have to acknowledge today I'm wearing white because it's Women's Equality Day, but when you still are living in a country that has one of the highest maternal mortality rates in the nation, you're not sure if you can afford the care you need when you're pregnant, and you have to drive hours to get the care you need because your labor and delivery or your hospital closed. That is if you have the insurance to pay for it. We are a long way from women's equality. And so I'm here to say we're sick of it. We're sick of people getting sick and not being able to get the care that they need. We're sick of people getting sick because they can't get the preventative care that they need. And we are fighting in Congress to reverse these cuts. And in the meantime, we're going to continue telling the stories like the ones that you are going to hear today. With that, I'll turn it back over to Kate.
Thank you so much, Congresswoman. Thank you for being a champion. And it doesn't seem that long ago, we traveled with you to Tazewell and had a room full of people who were also very concerned about that hospital. And that really is the gist of the Sick of It campaign. We are going everywhere. We kicked off in Arlington. We'll be in Virginia Beach tomorrow night, as this really is going to be a sustained effort. I do recognize, I think I saw Delegate Carlson coming in the back, and also wanted to recognize Senator Deeds and Delegate Amy Lawfer. Both wanted to be here, but weren't able to. They sent their regrets, but they have both been big champions in the General Assembly of doing everything that we can to fight back against these healthcare cuts. And next I'm going to pass it over to someone who has also been in the fight with us for a long time, Michael Sizemore of Sarah of Virginia. Michael, I can't believe it was just a year ago when we did that whole tour on the threat to rural hospitals with SEIU and Committee to Protect Healthcare. And you came with us to Charlottesville. We did an event with Senator Deeds, and then we went down to Roanoke. And here we are again, continuing to sound the alarm, but it's my honor to let you speak a little bit to how these Medicaid cuts are going to impact the population that you serve, as well as I believe you have your own rural healthcare story. Michael.
Absolutely.
I'll sit down.
Thank you for having me. We also did one in Harrisonburg, so we went all over the place.
Yeah.
I'm going to pander a bit. I had the blessing of being formally represented by former Congressman Tom Perriello, and Congresswoman Jennifer McClellan is my current Congresswoman. But back to the topic at hand. I work for an organization called Sarah of Virginia, Substance Abuse, Addiction, and Recovery Alliance, because everything in state government has to have an acronym. There are up to 200,000 Virginians dependent on Medicaid and Medicaid reimbursements and subsidiaries who are facing and dealing with the disease of substance use disorder. If they even get the slightest cut, they're not going to get the medicated assisted treatment, the counseling, any of those kind of things. So 200,000 Virginians who are suffering from a devastating illness of substance use disorder. If they don't get that coverage, you've got going back to using, overdose, and countless amount of probable deaths, as grim as that's to say. And I know the Congresswoman talked about rural hospitals. I know as of a JLARC study from July of this year, 13 are on the chopping block, and a few of them are in the entry stages of closure. All of the 36 rural hospitals in Virginia run on razor-thin margins. They rely on Medicaid reimbursements. I was born and raised in Southside, Southwestern Virginia. The hospital I was born in was just primarily for that, giving birth. There, the maternity wards, everything like that. If you needed treatment, that was an hour drive to a higher rated care facility. Usually we had to go across the Carolina border. As they're continuing to close these rural hospitals, what we thought was a really big inconvenience driving an hour for special care, I can't imagine what it's going to be like if the further just devastation in Medicaid is going to push further all around rural Virginia and the whole entire Commonwealth. And with that, I will kick it back to Ms. Katie.
Thank you so much, Michael, and thank you for everything that you're doing at Sarah of Virginia. I next am excited to introduce Dr. Mo Nadkarni. Dr. Nadkarni co-founded the Charlottesville Free Clinic, and I'm very curious your thoughts on how these free clinics are going to be sustaining all these cuts and the downstream effects there. I've really loved working with doctors throughout our campaigns. They are the most tremendous advocates for their patients, and excited to have your voice today.
Thanks so much. I'm very happy to be here. I'm wearing white, but I didn't know it was Women's Equality Day because I'm wearing my white coat. So yes, I've spent the last 35 years in Charlottesville working with underserved patients and rural patients. I started out as an intern. We actually got the Charlottesville Free Clinic going during the sort of Clinton healthcare era when we thought there was going to be nationalized healthcare then, and we thought we'd be in business for 6 months or maybe 2 years at most. And here we are, good 34 years later, still providing care to patients without insurance and who are in desperate need of care. I then spent 6 years out in Buckingham County at a federally funded qualified health center called Central Virginia Community Health Center, taking care of folks out in a very rural area in Buckingham County, where they really had very little access to care. And in fact, it was that organization that helped get women's health care into Farmville, Virginia, which is now being pulled away due to the cuts. But it's easy to cite numbers like 100,000 people losing their ACA subsidies, or 3 million people likely to get kicked off Medicaid, or 9 million nationally. But what really matters to me as a physician are the stories of the real patients who are really badly affected by these type of cuts. So I'm going to tell you very quickly about two patients I have. One is my active patient who's given me permission to discuss this, who is paraplegic and because of that doesn't move well and got lots of bed sores and in fact infections of the bone that need wound care by home health and wound supplies. He has been on Medicaid for quite a while, but he got kicked off and was unable to get his wound care supplies, which led to deepening of the infection, which led to an emergency room visit and then a hospitalization. Thankfully, he got his hospitalization, he got 2 weeks of IV antibiotics at an enormous cost, of course, and has been able to go back home. But if Medicaid goes away, he's likely to lose his home health again, and who knows what will happen. I think I know. We'll see a repeat of the story. The second Medicaid story I would tell is that of a young 21-year-old whose family was on Medicaid. He had asthma, which requires albuterol, which is an inhaled medication for asthma. They lost their Medicaid. He lost his albuterol medication. He had a respiratory arrest on a basketball court and ended up with me taking care of him in the hospital. And actually, it was very difficult to take care of him. I really was taking care of his mother, who had to make the awful decision of withdrawing him from mechanical ventilation because he had become brain dead. And that is in direct consequence of him losing his insurance, the family losing Medicaid. And that really led to one specific death. So imagine what that takes when you multiply that by 8-9 million people. And we're sort of back to the days where we started the free clinic with 15, 20, 25% of folks lacking insurance. So we really need to address this, and we need to address it now. Thank you very much.
Thank you so much, Doctor. And one of the things that we really strive to do at Protect Our Care, and particularly on this Sick of It campaign, is to elevate the voices of the patients and the impacted people. And next is really my honor to share a recording from a storyteller who really wanted to be here today and was going to try to Zoom in, but she just had spinal surgery last week and was not having a great morning, so she sent us a recording because she really wanted her voice to be heard at this event, and that is Christina Rivera, who is from Charlottesville. Bert, you want to go ahead and start?
Hi, I'm Christina Rivera, and I'm the Executive Director of Call to Justice. We're a Virginia-based nonprofit building the capacity of people and organizations who are fighting for justice. What a lot of folks don't know is that many nonprofits like ours rely on the Virginia ACA. We simply don't have enough staff to qualify or afford our own health insurance policies. Earlier this year, when the Virginia legislature rolled back ACA tax credits and benefits, what happened to our group filled the group chats all over Virginia. Nonprofit employees talking about how to drop our health insurance. We're not just talking about a few people, we're talking about hundreds of people who go to work every day with service and mission as their goals. And it happened to us, it happened to our family. Last year, I paid about $235 a month for health insurance premium through the Virginia marketplace. This year, that premium jumped to $1,336 a month. And that was even with a higher deductible. Now, I'm pretty sure most folks like us don't just have $14,000 lying around the house. $14,000 that they can just one day say, you know what, I'd love to give that money to an insurance company so that they can pay their executives billions of dollars in pay and bonuses. That's not the usual thinking of folks who are using the marketplace. Seriously, any other year, I would have just rolled the dice and gone without health care, honestly. We just don't have that kind of money. I would have tried to play the healthcare roulette game that so many of you know how to play, where you get all your appointments and testings in November, and then you fill as many 90-day prescriptions at the very end of December to take you, 3 months into the new year when you don't have health care. And then you just stop paying the premium in January, they drop you in around March, and you just hope for really good luck from March to December. But this year, I couldn't go without health care, or my family would lose everything. We'd lose our farm, our house on our farm, our tractor, all of it. Because I needed life-saving spinal surgery. Without it, I wouldn't be able to work, or drive, or even leave my bed. In fact, I'm recording this after that spinal surgery, recovering right now in bed. I had about 7 months to figure out how to come up with the surgery deductible, the unpaid time off, and of course that $14,000 more in premiums. All of this means that our family is stressed out at a time that we should be focused on my healing, because coming up with that additional $14,000, that keeps me up at night. Healthcare policy isn't abstract. It isn't something that they should debate in the legislature as to whether or not it's a good idea to keep healthcare premiums low. I want our representatives like Congressman McGuire and Klein to know that their vote really hurt people like me. Their votes should keep them up at night. That every day that goes by is their missed opportunity and their failure to do right by their constituents and to reverse these cuts and bring back the tax credits. Most of Virginia relies on these kinds of tax credits if we're using the Virginia marketplace. And we deserve better. And it's up to our representatives to get us affordable health care that actually cares for us. Thanks for your time.
All right, so I'm so glad that Christina was able to share her story with us today, and it also gave me an appreciation. I have been working with a lot of Affordable Care Act storytellers who benefit from these enhanced premium tax credits. And Christina's right. I think something like 9 out of 10 people qualify for these tax credits on the marketplace before the federal tax credits expired in January. And it's a lot of small business owners. It's a lot of employees of small businesses. It's a lot of self-employed people. And as Christina spoke to, she gave me an appreciation that it's also our nonprofits who are sometimes relying on that marketplace. And I have a lot of home care workers who are also relying on the Affordable Care Act for their health insurance, and some of them are dropping their plans. And you see this sort of downstream effect when you have, for example, families who are worried about losing their home care provider because they might go get a job where they can get health insurance. So this is definitely something that's going to have a broad impact on our economy. I do want to shout out the General Assembly and the Spanberger administration for doing what they can to try to mitigate the damage. The General Assembly did pass Affordable Care Act premium support program. It will partially backfill those cuts for people making up to 250% of the federal poverty line. But again, it's not going to backfill everything. And with that, it is my honor to introduce another champion of healthcare whose actions certainly speak louder than his words. Former Congressman Tom Perriello made a very courageous vote for the Affordable Care Act that pundits said would cost him his seat, but he followed his conscience and millions of people got health care as a result of that. So, Congressman, I just want to allow you the opportunity to react to anything you've heard on this panel today.
Thank you so much. Thank you, Christina, for sharing that story. I just want to be clear that this policy, this bill, was not just cruel, it was incredibly stupid. If the goal was to try to hurt poor people, it was designed in a way that also hurt the middle class, it also hurt small business, and most of all, it hurt rural communities. And it's just a matter of math. These clinics cannot stay open if they do not have enough paying patients. When you have patients who can no longer pay, they cannot keep their doors open. It was entirely predictable. The clinic leaders all told McGuire and told Klein that they would have to close. We saw 3 clinics close already. Labor and delivery closed in Farmville and South Boston. We have 11 of the 24 counties in this district no longer have a single OBGYN operating. And when you think about the impacts of closing rural clinics, it's not just screwing over rural communities. Where do you think those patients are going? They're coming to Charlottesville and to Lynchburg, where we then have longer wait lines, we have a larger number of uncompensated care, and do you think the insurance companies take the loss? No, they pass it on to the rest of us. This bill has already been a death sentence for rural communities. If they push us over the cliff in January, our rural health system will never come back. I was talking to a woman in Halifax County a few weeks ago whose mom had a cardiac event. They got her to the hospital in South Boston. One of the paramedics afterwards said that if that hospital were closed, as is predicted from the new bill, her mom would have died on the way to Richmond. Your zip code should not be a death sentence in this country, and that's where we are headed. And the tragedy isn't just the lives that are already being impacted. The story I'm hearing most often over the last year is young people saying they've had to make the decision not to start a family because they can't afford it. One of the things I was proud to do in the Affordable Care Act was to demand that prenatal and postnatal care was covered, because it's actually considered a loss leader to the insurance companies and that they lose money up front, even though it saves everyone money over time. So as often happens with the insurance companies, they will do exactly as little as they are mandated to do. So we made it mandatory. John McGuire and Ben Klein just handed them a perfect excuse to not cover prenatal and postnatal care, which is that if it's in your insurance, but you simply can't access it, what does that mean? As the Congresswoman was saying, if you have to drive an hour and a half to get your prenatal care at $4 a gallon of gas, you're not making that trip. You're either deciding not to have kids, or you're moving 2 hours away from your parents and grandparents, who are your child care system, your support network. So we are seeing not just the death of these rural health clinics, but we are seeing the literal death of these communities if people have to move away or choose not to start families. And the impacts on the rest of us are clear. Christina mentioned it. I'm on the Affordable Care Act for the 4th time since I voted for it. It's great to have it there. But my premiums went up $400 a month this year. That's almost $5,000 out of pocket, in addition to the higher gas and grocery prices from the tariffs and the war. They're literally just taking that money out of our pockets in order to give a tax cut to Elon Musk that he's not even going to notice. So we have a point right now, and I think this is also where McGuire had RFK Jr. to Danville recently, and they said the quiet part out loud. When asked what they were going to say about this death of our rural health care access, they said, well, we think artificial intelligence will be the answer. What they're saying to our rural communities is, you don't get to talk to a doctor or a nurse. You're going to get your care from a bot that's going to be driven by an algorithm that denies you care until things get catastrophic enough that you can die in the rescue squad on the way to Richmond or Charlottesville. That's their answer for rural health in our communities. And what's so frustrating is that we have done work to fix this at the federal level and the state level under then Senator McClellan's leadership. We know that when more people have coverage, they get more preventative care, and we actually reduce the overall costs of health care, not just for those on Medicaid, but for those in the middle class that are paying premiums on the exchange. So this is a solvable problem, and this crisis, to be clear, is a man-made crisis. And the decision was to deliver this kind of blow to families that are struggling in our communities. And when it comes to public health, we are in this together. When you screw over rural communities, that spills over into our small towns and into our bigger cities and continues to put more and more pressure on our paramedics, on our emergency rooms, and on the pockets of every family that we know here in Virginia. This is an urgent time. This is the last thing I'll say before heading back to Katie. Some of the damage has already been done, but we cannot overstate how big this cliff is in January. If this is allowed to hit, if this Congress is allowed to continue to have its way, we will see the shuttering of hospitals and clinics like we have not seen certainly in my lifetime, and we will not see those clinics come back. We will see families have to leave their communities or simply be abandoned from any care and live in these maternal health deserts. So this is an urgent issue. Some of the damage is done, but far, far more has already been written into this bill if we don't have a chance to reverse it. So thank you all for letting me be part of this today.
Thank you so much, Congressman, and thank you for your voice and your leadership. And I think I have time for one question, and was just curious, Congresswoman McClellan, when you're in Washington, I know you're having conversations with your Republican colleagues. Like, are any of them privately recognizing, after hearing from their constituents who are starting to lose their health care, just how concerning this is?
Well, some of them aren't listening to their constituents. They're not having town halls, and I don't know if they're doing roundtables. At least one has expressed concerns during the debate of the Big Ugly Law and said, well, we're going to have a rural hospital fund that'll take care of it, but that's a drop in the bucket that's not going to address the economic devastation of these hospitals closing. If the Bon Secours Hospital in Emporia closes, that's the third major employer that will have closed in less than 2 years. And between Boar's Head and Georgia Pacific Paper Plant, they can't survive that. And then they don't seem to make the connection between the SNAP cuts and increases in food insecurity, the cuts to some of the things that would help us address climate change and extreme weather and the impact that extreme weather has on public health. And so in addition to these cuts, meaning fewer people can get the care they need, more people will get sick. And the only justification one of them gave to me was in a public meeting, so I can say this publicly. Rob Whitman said, well, this is all about controlling the debt and waste, fraud, and abuse. Well, I'm sorry, this bill exploded the debt to give tax cuts to Elon Musk and Mark Zuckerberg and Jeff Bezos so they can buy a boat, I guess. And it's so they talk out of both sides of their mouth. But their vote, the way they vote on these bills, and whether they sign discharge petitions to reverse the cuts, that is what is really telling. Not the words that come out of their mouths, but their actions that ignore the plight. And I just want one group we have not talked about, but I spent a lot of time with last week, are farmers. Over 90% of the farms in Virginia are family-owned and small or individually operated. They are on the Affordable Care Act. They are struggling to make ends meet. This trade war is making that worse. The cost of everything has increased. They have fewer markets and less money coming in their pockets as extreme weather destroys their crops. And now they're losing their health insurance.
Well, thank you so much, Congresswoman. And I would remind folks that the Republican members of Congress, and it was all Republican members of Congress who voted for the Big and Ugly Law. Not a single Democrat voted for that. They need to hear from you. They need you blowing up their phones. Congressman McGuire needs to hear about the stories like Christina's and what it means to have to pay more than $1,000 per month for your health care, and having no choice because you do need a life-saving surgery. They need to hear about the threat to hospitals, including the at least 2 in this district that are at risk of closure. So please continue to make your voices heard and really hold every person who voted for that Big Ugly Law accountable. I want to thank Congresswoman McClellan, Congressman Perriello, all of our panelists today, everybody who came out to hear this important discussion. Zocalo for being so easy to work with. Just wonderful place to hold an event. So it's good for me to know moving forward this is going to be one of my go-tos. And I know a couple of our panelists have a hard out right at 2. So I am going to invite any of the panelists who are willing to talk to reporters to come with me, and reporters, we can arrange some one-on-ones so that you can get that footage. And with that, I want to thank you all for joining us, and that concludes our program.